Often they can have similar findings as a stroke-like presentation, and if the patient has a brain tumor on the right side of their brain, you'd expect left-sided body symptoms. So their arm or leg might not be working, a lot of drooping of the left side of their face. You can also have what we call dysarthria, and what that means is that the speech isn't so much that you can't say what you want to say, but it's just very slurred and hard to understand. If the tumor is on the left side of the brain, then you'd have right body symptoms, and that's where we'd have a lot more speech issues. So you could have something called an aphasia. Aphasia is when you either have the inability to say the word that you want to say, or you just aren't able to say anything that makes sense at all, and you're not even aware of it. Those are two different common types of aphasia. Some confusion also is another common presentation symptom. And certainly seizures is another way that brain tumors are found. Often first we'll start with just a regular non-contrast CAT scan, and that'll show us really kind of down and dirty, is there a problem here in the brain or is there not? Usually we'll see swelling from the brain tumor on that type of a scan. Maybe if there's any bleeding, we'll see that. If there's any calcium in the tumor, we certainly can see that. But more than anything else, it's the swelling and any sort of pressure on the surrounding brain structures will show up on a CAT scan, and we'll be able to identify, hey, this is a brain tumor. This patient needs a brain MRI. So an MRI is a different type of scan where we use a magnet and there's no radiation, and we do need contrast for this study, and that shows us where the brain tumor is, and it shows us the breakdown in what we call the blood-brain barrier, which is a really complex thing to go into, but basically our bloodstream is really kept separate from the brain, and it doesn't let things out that aren't supposed to get to the brain. But when there's a tumor that injures that pathway, then things can leak out through the bloodstream into the brain or and the brain tissue, and that's where the contrast will then enhance the tumor, and we'll see a brain tumor on the MRI scan. This could be a benign tumor, this could be a malignant tumor. You just can't tell that right away. You can have a feeling, but you can't truly know what it is until you have a piece of that tissue, piece of that tumor, confirming this is the diagnosis. We have to do some sort of surgery, and the two surgical options are either a biopsy, meaning just taking a small piece of it through a very small operation just to confirm the tissue type so we can then start treatment, or we can go to surgery and do what we call an open resection, where we take the tumor out as aggressively as we safely can do so, and then send that tissue to the pathologist, who will then give us an answer of what kind of tumor it is, et cetera, et cetera.